Hello, everyone, and welcome. Today, we will be reviewing a case study, and the case study will consist of an office visit. And this is going to be for an established patient. So let's take a look at our first patient, who is patient Albert. So one of the things that we want to do is the patient registration is just going to give you that background information, but we're going to focus on the coding part. So you can just click right here where it says history and physical. And if you notice, it'll open up in a small box here, but it's very small as you can notice. So let's close that up. And another way that you can look at it is by you're going to right click on it and then open in a new tab. And then it'll open up large so that we can actually see it. So let's look at the note for today. So we have our patient, and first thing we're going to look at is the history of the present illness. And so I'm not going to read through the whole entire thing, but first thing we notice is that the patient has hypertension and hypercholesterolemia. Also, the patient is in for a general checkup. The doctor is reviewing the patient's meds, looking at the patient's blood pressure, and we can see that it's a little elevated. It's 140/90. The patient is having intermittent pain in the lower left abdomen. And then it's just going on to give some more background information. So of course, we're going to look at the history of the present illness. We're going to look at the review of systems. We'll look at also any allergies, the social history, because all this is going to factor into which CPT code we're going to use. So based off of reading this so far, we know that this is for an office visit because the patient is coming in for a checkup, and that we know that this patient has been seen before because based off of what the doctor has written, they've obviously had a relationship with this patient. So then we'll go down to the assessment and plan. So now we need to first look and see, we know that this is an office visit. So we'll look again at the HPI, which is the history of present illness, the review of systems. We'll look at the assessment and the plan. So after reviewing all of those things, and there's actually a page 2 to this. So let's actually open up page 2, and we're going to open in a new tab. And so here is the rest of the note. So based off of the documentation, we know that it's going to be an established patient in the office, and so it's going to be a level 3 office visit, which would be 99213. And if you want more details on what is included in the 99213, you can actually review your textbook. But since this is in advance and we've already went over a lot of this, so that's why I'm not going to get into details because this is basically a review. So we have our office visit of 99213. And then now we have to start assigning diagnoses. So one of the things that we noticed is that the patient came in and they have this intermittent pain, but we don't know why they have this intermittent pain. So we can add a Z code for that intermittent pain. And so we'll use Z code Z00.01 for abnormal finding, because that wouldn't be normal for the patient to have that pain. And then we're going to go on to start assigning the other diagnoses. So we know that the patient has hypertension. So we can go ahead on and assign a code for that. Only information that they're giving us is that the patient has hypertension. So we'll just use the I-10, ICD-10 code, because that's all the information that we have. We'll go over to page 2. We'll also assign the diagnosis for the hypercholesterolemia. And so we should have diagnosis code E78.00. We're also going to assign the code for the left quadrant pain. because the doctor still diagnosed that pain, but then the doctor also sent the patient off to get a CAT scan to rule out diverticulosis. But we can't assign the code for diverticulosis because the patient hasn't actually been diagnosed with it. It's to rule it out. So of course, we remember from our rules, we don't code rule out. So that's why we can code the left quadrant pain. And so that's going to give us a diagnosis of R10.32. And so in order to completely code this case, we'll actually have, again, our diagnosis of the Z00.01. We'll have the I10 for hypertension. We'll have the E78.00. We'll have R10.32. And then for our visit, we'll have the 99213. Now, also remember, you guys have access to an encoder, so you can use those as well to check your answers before you go on to the next question. So you want to make sure that you're using all the tools that you have, and also the ebook comes with an encoder as well. So for more information, again, look in your ebook, look in your CPT manual for additional information, or you also can email me. This is going to conclude the case study on patient Albert. Thank you.